Most healthcare providers became doctors because they wanted to change lives. What nobody told them is that the health of the practice can have as much impact on patients as the care delivered inside it. When a practice is struggling, patients wait longer, services disappear, providers burn out, and the mission that drove someone into medicine quietly erodes. Tatiana, you've worked inside a wide range of these healthcare practices. So before we get into the specifics today, I want to ask you something. When you walk into a practice for the first time, what tells you within, say, the first conversation that this provider is leaving significant money on the table and probably doesn't know it?
There's a list of things that I could go over when it comes to that, but I think the most probably prominent evidence of a practice struggling is whether the practitioner or practitioners in the practice sell time for money. If they're not developing programs that are centered around preventative care, if they're not really truly sitting down and thinking about how do I support these patients outside of just 2 calls a year or 2 meetings a year, 2 appointments a year, outside of 2 lab works done, kind of, they're definitely leaving money on the table, and usually comes with a bunch of other things, but we're going to go into that later.
All right. So joining us today is Tatiana. Tatiana works with healthcare providers and business owners to help them better understand the financial and operational side of their organizations and identify opportunities for improvement. Today, we're going to explore how the health of practice can influence its ability to grow, support its team, and serve patients. So I didn't mention your last name there, so I'm going to throw in the last name for you here too, Tatiana Tsoir. So there's a phrase that appears throughout your work. Business is personal. When most people hear that, they think it means you bring empathy to the numbers, and you probably do. But I suspect it means something more even specific in that. What does it actually mean in the context of healthcare? And how does it change the kind of work you do with a provider?
Business is personal means that it's never just business. In my experience with working with a number of providers over the years, I found that the best ones, like the best doctors who deliver the best preventative care and really holistic health to their patients, are usually the same ones really bad at the financial stuff. What I most often see is that those providers typically struggle to make ends meet, which is insane to me. The flip side of that is I see sometimes providers who all they think about is money, right? And so they order unnecessary procedures, unnecessary tests. Maybe some of it is paid for with insurance, maybe not. Unnecessary drugs where something could be solved with something as simple as vitamin C or vitamin D. And so there are kind of two, I would say, extremes on the spectrum, right? People who put patients first and kind of themselves last, and then people who do the opposite of that. And so we all grow up in certain environments and circumstances, and we all bring how we were raised and how we are today, what we're going through personally today, into our businesses, whether we like it or not. Something happens, somebody cut you off on the way to work, you get pissed off and you come to the office already agitated. How can you possibly show up for your patients and really think about how to serve them best? So when I say business is personal, I mean everything, right? And as a financial practitioner, I understand exactly what each provider goes through, the stress, the financial stress, the making ends meet, the making the equipment payments, paying staff to support patients, all of these things happening at once to someone who all they want to do is help people.
Right. So that's what we're going to go into today. You can see that this conversation is going to be about something most medical schools never teach: how the financial and operational health of a practice determines where timeless wisdom lights your wellness path.
So, most healthcare providers are trained to diagnose the problems in their patients, right? But
Right.
not trained to diagnose a problem in their own business or their own practice. And yet those two are more connected than most people realize. So today we're going to get into that a little more and what, a financially stressed practice actually is costing, not just to the provider, but to everyone inside that practice. So welcome to the program, Tatiana. It's good to have you on. It's good to see you again. And when a practice is under that financial stress, most providers think, how that's affecting themselves personally, right? Their anxiety, the long hours, the sense that they're working harder and getting less. But what's that trickle down effect that is happening to the patients that they're serving in the practice?
I think the biggest problem in this is that providers were taught by medical schools or whatever that is, maybe by peers, mentors or whatever, that more patients equals more money. And so the only way to make more money is to have more patients. So generally speaking, providers kind of pick their lane in terms of take insurance versus not taking insurance, right? And sometimes they switch. Sometimes those that do take insurance switch to not taking insurance because they realize that the insurance path is not always the best for the patient, right? And so the way it works is, think about it this way. I have a number of clients, and only one provider, one practice takes insurance. They have 4 providers under the main doctor, and they take insurance. And so the max that each provider can see is 600 patients a year because they do primary care. Now, when I talked to the doctor, or the main doctor of the practice, the owner of the business, and when I asked him, what is your mission? Like, what do you see yourself doing in life with your skills, with your business? He said, I want to impact 10,000 lives. Well, on the surface, it sounds really good. It sounds like a noble mission. But then when you start digging, you see that every provider, they see patients for sick visits, annual visits, and all of those things. Yes, they get functional integrative care, but is it enough? Is 600 patients really what serves the patients? I mean, think of it this way. 600 patients is, if you work 365 days a week, is roughly two patients a day, right? If we divide 600 patients into 220 days a year, that's maybe 3 patients a year. Okay. You can make that schedule a little bit better. Let's say every patient comes in twice a year, at least. If they're seeing primary care, they come in for a sick visit. The math is really actually simple. You don't have 5 minutes a year to spend thinking about how to support that patient's health journey and to really impact their life. It's just impossible on 600 patients. So that model where more patients equals more money doesn't work. And it takes some providers, it takes decades to realize. So, when this client in particular, if it takes insurance, says, I want to impact 10,000 lives, that's great. It's a noble mission, but then how do you actually do that? By taking insurance. Is that the right way? Because the insurance can tell you, well, you told that person that taking vitamin C will help their problem, but really, because of the American Association of, physicians or whatever that is, right? We don't like how you practice, so we're going to take the money back for those appointments for you. So they have the power to take the money out of your bank account because they don't like the advice that you give, because that advice doesn't involve big pharma, it doesn't involve the American Association of Physicians or pediatrics or you name it, right? And so that's the problem. That's the root cause.
Yeah, but now, Tatiana, are you advocating that the doctor doesn't take insurance so that, Breck and Dr. Bob and I can't go see them? All you want to do, you want to just be private paid doctors all over the place?
Yes.
Bye. No more. I'm not talking to you anymore.
A lot of physicians are going to a combined model where they'll take insurance and they'll have a concierge service where they charge people a lot more money for rapid access and things like that. So I don't know if you want to comment on it now or later, but I just wanted to bring it up since we're talking about compensation.
Yeah. I think a hybrid model is doable. It's just, to me, it's less about the model and more about what really serves the patients. When you have orthopedic surgeons looking at a patient, they only are fixing what the problem is today. They're not looking at the whole body. Why did that person get arthritis? It's because they probably have some sort of an autoimmune disease that they're not managing at all. And so that's where I think the root cause of the problem is that we're in the US, right? I didn't grow up in the US, so I have a slightly different experience. Not that it's perfect by any means, but in the US, the specialization of doctors is what causes the problem. And also lack of proactiveness in health is a part of it. When, my dad had cancer, he was a doctor, he was an MD, and when he was diagnosed, he said he adjusted his diet to exclude everything that cancer grows on: sugars, fruits, carbs, dairy, all of it. He was eating high protein diet, some carbs, certain carbs, complex carbs. And because of that, his survival prediction was, I think, 30 months. Survival rate was 11% for stage 4 colon cancer. He lived 6.5 years strictly because of the diet. Strictly, he did very minimal chemo. It was well managed. And then he kind of went down the drain when he really got tired of not really saying no to everything that he wanted to eat. So during COVID, it was a perfect opportunity to do that. So he passed away, but he could have lived another 10 years easily with that diet, right? But when I ask a couple of friends of mine have husbands who are doctors, and I ask them, why do you not tell people that they should adjust their diet as soon as they get diagnosed with cancer? Why do you not tell them to remove sugars from their diet? Because that's what cancer grows on. The doctors say, I'm not a dietitian. It's
Right.
not my job. And that's a problem.
Well, the problem is, I mean, we have to face it. We have a serious medical education problem in this country in general. We could have a whole talk about that for a whole day. But the thing, I mean, when I got my PhD in pharmacology, I took all the medical school courses, and they don't get anything about business. They don't get anything about economics. They don't get anything about communication with patients, really. And the people who are teaching them have not demonstrated their ability to be successful in the environment of practicing. So, it's challenging. I really feel for doctors who come out of the conventional medical education
Okay.
system.
So I appreciate that, Bob. So, Tatiana's got me a little fired up here now, saying all she wants to do is just take money out of people's pocket, won't take any insurance. What's the range of the practices that you work with, Tati?
I work with a couple of different ones, right? So only one of them, well, two of them take insurance, but one is a traditional, meaning functional, but traditional in a sense that they do primary care. Like everybody else has a waiver that says it's a non-PCP relationship. So just you gotta disclaim that as a patient. The second doctor that I work with, he's more of a specialty procedures doctor. So he does vein work, about 50%, and a couple of other procedures that are very specific. And so that's where his specialty is, and that's what he learned. He does it in a functional way, meaning that he talks to the patients that they should be looking at their lifestyle, their nutrition, their exercise, and all these things, because the stuff that he just fixed will come back. But everybody else, every other practice, depending on what it is, sometimes it's solo practitioner, sometimes it's partnerships with a number of doctors in the practice. Sometimes it's a situation, more often than not, where it's a doctor and then a couple of NPs or PAs or both. So combination of that kind.
All right. And when you interact with that range, are there two or three profit leaks you see consistently?
Profit leaks everywhere. I think the biggest profit leak that I see comes back to the root cause, where it's too many patients per one practitioner and not really serving the patient. But the profit leak presents itself as, I'll give you an example. A doctor sees a patient with autoimmune twice a year. Twice a year, the patient pays that doctor for the lab. So, for the lab kit or whatever, for the lab work, or pays the lab directly, depending on the state. And then the patient also pays for the consult. So for the doctor to go through the lab and update care plan if that's what they've got, this is something I get every 6 months. So in total, let's say the patient buys some supplements, whatever. In total, the patient spends maybe $1,200 a year on a maintenance package, right? So let's say it's $500 for the doctor twice a year, so $1,000, and $200 for some supplements or whatever. $1,200, right? Then this patient, like me, for example, goes into the portal every month and requests, or every 3 months, and requests a refill on their thyroid medication. Somebody has to read that message. Somebody has to prepare the prescription. Somebody has to look over and review that prescription for the patient. No doctor is charged for it in a traditional model. So basically, it's kind of like accountants, right? You pay an accountant to prepare your taxes for $1,000 a year, and then you expect them to answer quick questions and things like that throughout the year. It's the same exact thing. And that's what I feel is the biggest profit leak. That's what I see until the provider really thinks about, okay, how do we make it sustainable? Because providers are often forced to have 5-6 people on staff just to support the patient base, just to respond to their messages, just to look at their lab results, just to look at their prescriptions and approve and send them to the pharmacies. It's just not
Okay.
a sustainable model.
All right. So you see that. So when you do that kind of deep dive review of a practice, what have you found surprises the providers the most about what you find and what's found?
I mean, due to the nature of what I do, and we focus a lot on proactive tax reduction. I really, really believe in proactive and preventative care on the health side, and on the business side, right? And I practice what I preach. So I think the stuff that surprises providers most is how good and timely accounting can help them make better decisions in business. One of my providers, until they started looking at their books, which we started preparing them every week, every month, saw that they were spending $4,000 a month on paper. $4,000 a month, where with the EMR, you don't have to spend anything on paper.
That's
And
crazy.
and
Yeah,
overpaying staff.
and they could have afforded to take a few insurance clients.
It's just amazing how, and I have this one provider. She's starting out on her own, so she works somewhere, but she's already given notice, and she's starting out on her own.
Mhm.
Very talented, well trained, and so she came up to me and she was like, "I don't want to deal with any of the business stuff. I just want to make people feel better."
Yeah.
And I was like, I love to deal with all the business stuff, and that's a great synergy. But it takes a little bit for people, especially who've been running what they call a business, and I'm going to explain what I mean. Who've been running it for a few years, or 10 years, or 15 years, and really had some good traction, but really have nothing to show for it. And the reason I put business in air quotes is because most providers that I meet initially don't actually call it a business. Most of them call it a practice, and we do too. But I use that word very loosely. And there's a difference between the two. In a practice, people are selling time for money. It's all about appointments, seeing patients. Yes, you're not seeing 35 patients as a typical PCP a day, for 35 to 45 patients a day, right? But maybe you see 15. Still pretty exhausting if you're working 5 days a week. And then as soon as you leave on vacation, your business is suffering because there's no revenue coming in that week. But you still have costs of staff and so on and so forth, right? So it's kind of a vicious cycle. But in a business, in a true business, we don't just make money off of our time. Sometimes we do, sometimes we don't. But it's a combination of things. It's a hybrid model. And we're really looking at making money off of other resources, whether it's people, equipment, products, or whatever that is. That's a real business. When it's just one provider seeing patients all day long, it's not a business, it's a practice.
Yeah. Dr. Bob, you spent a lot of your career, at the intersection of clinical excellence and organizational health. And when providers are operating, inside of a financially stressed practice, how does that affect them? And does it affect their clinical judgment?
I think every aspect of the whole practice or business or whichever term you use is affected, including the patients. To get good care, it's teamwork. It requires a great team. The practitioners have to be really great, and if they're stressed out and they're anxious about what's going on, it's like a mother who's pregnant. Anxious mother, anxious baby, anxious doctor, anxious patient. I mean, there's no way a doctor or any practitioner can connect with the patient when they're stressed out, when they've got a lot on their mind, when they're distracted. So, and then, so everything becomes unhealthy for the practice, the practice providers, the patients, everything. And I think patients can tell that when they come into practice. So it's really important for the people who are running the practice to know that they have to take care of themselves. I always say you got to take care of yourself first before you can appropriately take care of others. Otherwise, it's costing the person their health, their happiness, money, unhappy patients. The cost is huge.
Yeah, no, I appreciate that insight. And Tatiana, we got to get under Tim's skin a little more with the insurance versus cash pay too, because that deserves a discussion. Because there is a lot of people that are moving towards the DPC model, the direct primary care, concierge medicine model. What are you seeing as a difference between insurance-based practices and cash pay practices?
It's actually very interesting. So those two clients that take insurance, one, I would say specialty procedures is a different practice, right? Because procedures typically are, especially in the area where this practitioner is working, are pretty well reimbursed because they're necessary procedures and they really make a huge difference if done correctly. This one practice with a number of, I think 3 or 4 nurse practitioners with one doc who doesn't really see patients anymore. What I see is that, and this is something that's really interesting because, again, good accounting saves lives. If you look at their profit and loss statement, you'll see that 80 to 85% of cash comes in through primary care. But when you talk to them, and I say them because it's a couple of providers in the same partnership, when you talk to them, all they talk about is procedures are the ones that make money. And when I hear that, I go back to the P&L and I'm like, show me how that actually make sense to me. Because what primary care revenue, that's 80% of their cash in, what it does is it covers their overhead, the cost of actually sustaining those patients, the front desk, the nurses, the IVs, the scans or medical assistants or whatever that is, right? And so with the insurance, it's that way. But then another provider is concierge only, non-PCP. And for them, primary care is only 25% of their revenue. And so then the question becomes, and I always try to look at what's the root cause in medicine or functional medicine is a business model in business. I always look at the business model. What is that queen bee role that we are working with? And sometimes it's something very unexpected. So for, let's say, a functional provider that I use as an example, 25% of the revenue is quote unquote primary care. Not really primary care, but consults, appointments with the doc. But then supplements, peptides, procedures, specialty stuff, aesthetics, right? Aesthetics is my personal pet peeve because it requires a lot of expensive equipment and usually doesn't pay for itself. And that's where the doctors usually, what I see, go bankrupt or almost bankrupt, which is interesting to me. But all of those things support the business. But then when you start looking at, like, I've consulted this one practice. I mean, my firm does the accounting and tax for them, but then I also do one-on-one consulting with some of them. And they asked me to help them restructure their revenue model, so their business model essentially, and make it less dependent on the providers, still dependent on the providers, but less dependent on the main doctor, because the doctor was just getting older and not really like working his butt off and not really putting any money aside, nothing, living paycheck to paycheck. Imagine somebody who's spent 20 years changing people's lives, a really amazing doctor, can't pay his bills. Like, to me, it's mind blowing. And so they asked me to help them restructure. And what the first thing we started looking at is what percentages of each of these different services bring in the most money. And then we started looking at the costs.
And we'll go into that a little bit more in the next. You and Dr. Bob, well, I'm trying to think you two grew up in the same household. I always like to run for it to the solution to get to the end thing. That's our next segment after Breck does a little bit for us here.
Yeah, and I do see a lot of people gravitating to those DPC models, direct primary care, and that's a little for your business, Tatiana, and accounting. That's got to be make a lot of sense to you because it's a monthly residual. Someone's paying a subscription monthly, whereas the insurance-based doctor provider is waiting for that patient to walk in the door. They can't bill until the insurance patient shows up, where the DPC or concierge doctor is getting that monthly subscription. Yeah. So before we jump into the promotion, a lot of providers assume that the answers are working harder, seeing more patients. You clarified that isn't going to be the answer for them. And after the break, we're going to go into a little more detail on that. But first, if you are looking for practical ways to support your health beyond today's conversation, take a look at some of the solutions we personally use and recommend. Brain IQ Pain Eraser Roll-On, used by our very own Tim Daniels. After years of knee damage as a D1 athlete and an avid exerciser, he gets relief with Brain IQ Pain Eraser. Delivers instant targeted relief using advanced nanotechnology combined with powerful natural ingredients, all natural, that absorb quickly right where you need them. No pills, no mess, just roll it on and get back to moving. It's ideal for lower back pain, knee pain, shoulder pain, joint discomfort, or everyday aches and pains. Makes it a great option for active adults, busy professionals, or anyone just tired of pain slowing them down. Try it for yourself and experience fast targeted relief with Brain IQ Pain Eraser Roll-On. We will leave a link in the show notes. So now we can move on a little further on what we were teasing about before the break. And we talked a lot on this show about what wellness looks like for the individual. Now we want to see how we can provide that wellness for the organizations as well. So what does a healthy practice actually look like? And what makes it possible for people to work inside that practice so much better?
A healthy practice has really a deep understanding of what they're really in business for, I think. And I think the most important piece of it is really realizing that the more patients, more money doesn't actually serve anyone, doesn't serve you, and it actually doesn't serve the patients. And here's what I mean by that. And by the way, when I talk about this, I will say that there's really no competition when you shift your mindset and around this concept. So think about it this way. You have 600 patients who want to see you twice a year. That's 1,200 visits a year. Do you actually, if you calculate it, right, if you work 5 days a week, let's say you take 2 weeks off during the year, that's 50 weeks. That's 250 days, right? And if you see 1,200 patients, let's say it's 1,200 divided by 250 is around 20%, right? Do you actually have time to learn new things? Do you have time to read new research? Do you have time to really open someone's chart before confirming their prescription and think, maybe we should change something for this person. Maybe we need to lower their dosage on their thyroid medication or increase it or whatever. No, the answer is no. You don't have time to do any of that. So the patient, even in a concierge practice who pays money for every visit, $300, $400, $500 a visit, whatever that is, isn't getting what they're really paying for if you work yourself to death because you can't make ends meet. And
Mhm.
so in a healthy practice, there is some sort of a hybrid model that puts patients first, right? But also puts the doctor puts themselves first, exercises, sleeps, practices what they preach. Because do I really want a doctor who can't fix themselves? How could I really trust their opinion on that? If somebody's going through, to your earlier point, you were talking about how somebody's stressed about money. Money is a big part of it, right? Money in the United States, and it's different where I grew up. Money goes directly to the need for security on the Maslow's hierarchy of needs. And the reason is that in the US, you lost your job, you're on the street. You can't buy food. And it's different in, where I'm from. But money worry is a big deal. And especially when you kind of don't want to open your credit card bill because you don't want to look at it because you don't know what to do about it. So I think, and I see in healthy practices, there are some programs, memberships, whatever that is, that actually allow someone or not allow someone, maybe allow someone to take responsibility for their own health. I think that's the biggest mindset shift for patients. And that's the biggest mindset shift for the doctors. My mom, is a doctor, and she works at a hospital as a pulmonologist for, 10 years. And then when my sister was born, I was about 10. She actually left the hospital, maternity leave and whatever. And then when she came back, she left within a month because what she saw is that most people, according to her, don't want to be healthy. They just want a pill to make the pain go away. But I think that mindset is very, very common in the US as well. Want to make the pain go away. And here's the thing. Often traditional doctors also want just the patient's issue to go away. And it's not a sustainable model.
So let's get a real world example here, and without naming names, give us an example of a practice that was struggling. The owner didn't even fully see what was going on, what you found, and then the changes you were able to implement. And then what did it look like on the backside after making those changes for the provider, for their staff, for the patients?
So, yeah, definitely not naming names. But before this provider came to my practice, to my business, they were actually on the verge of bankruptcy. They had 1,800 patients, one main provider, a secondary provider who was only seeing patients maybe 2 days a week, with whom this doctor made a really terrible deal. It was actually costing him money to have this doctor on staff, which is crazy. That's number one. Then a combination of a couple of bad decisions, like kind of not looking at the fine print, not looking at the details, not looking at profitability. So when I first met him, he said, aesthetic procedures make us the most money. They're most profitable. And I'm like, really? Show me the numbers. Well, guess what? That low monthly payment wasn't making him any money. It was actually a drain on the business cash. People thought, aesthetics is nice. Coming in for some Botox or whatever is wonderful. But I'm really coming in for the doctor's hormone or whatever specialty. I wanted them to fix me so that I can live my life better. And so that was number two. Number three, this is the doctor that was spending $4,000 a month on paper, where he was also paying a bookkeeper. I think we started working in like August. The bookkeeper was paid every month since the beginning of the year, the years before that, but the books weren't done like at all for 8 months. So when you ask the doctor, how much money are you making on procedures? He just says, I know I make a lot of money on procedures. Great, but can we please look at the numbers, right? So, but what we did is first we got them up to date. Good accounting saves lives, financial lives, to begin with. And also, once you have accounting done, you can actually implement some tax savings into the business. You can actually set up certain procedures. And we don't do kind of like a high risk strategies and in tax, because what I want to be able to say is I want to be able to defend a tax position that I took as a CPA. I want to be able to say, we took this position because the business does this, this, and this, and we have all the paperwork and money trail to show for it. I want us to win the audit if there is ever an audit, but usually it doesn't even get to that. So what we did is we restructured. We actually sold some aesthetics equipment. Some of them was returnable. We returned that. We built their chart of accounts because I turn books into not just books for accounting and tax, but also for management decisions. So I split expenses into categories, into groups. And then I look at, okay, what's the group that drives the most revenue? What's the groups that's the biggest drain on the business? Is there anything we can do there? So after doing all that work and building a financial forecast, also very important, because then you can see when to expect cash dips. Because, every business is cyclical. There's always cash dips. If you look ahead long enough on a 12-month schedule, you will see a couple of months where maybe, holidays, people are not coming in. Maybe whatever, it's the summer, people are traveling, so less revenue. After we built the financial model and made all those changes, the business started making $100,000 a month net with just one provider. And then we've hired a provider. And then the business suddenly started selling programs. And people started shifting to the provider once a year and to the main doctor once a year. So the doctor all of a sudden had an ability to actually go and read a book, to read an article in PubMed, to read a citation on a peptide and actually serve their patients.
Okay. So you just went through, I guess one of your pet peeves is this aesthetic stuff. So you said, you've gone through here looking at practices and adding in subtracting services from the aesthetics to the functional medicine approach to peptides. And then we did talk about regenerative therapies really, but also you did also mention cash pay wellness programs. So what are the financial and operational questions that a provider should answer with you or to themselves before making those investments or de-investing?
Biggest question and the hardest question really to answer is the return on investment. What's the return on investment? With aesthetics, let's take something simple as marketing, advertising. Depending on the kind of business, 4 times the ad spend is just not enough because it doesn't cover, let's say you spend $100, you bring $400 worth of revenue. Oftentimes the 300 is not enough to cover overhead. And so what is that return on investment that makes it worth it? How much time of the provider is involved? How much time of the staff is involved? What is that overhead split? What are other direct costs? Supplies, gauze pads, syringes. What are all of those costs? And so when you look at it and people tell me something like aesthetics is very profitable, it may be for some businesses, for some medical practices, it may not be. Actually, a good example one of my providers told me about is somebody comes in for a Botox injection and you charge by units. This particular doctor charges by units. And somebody just comes in and gets 10 units. Well, you just spend half an hour that's worth $1,000 injecting somebody 20 units, which you make $130 on. And the doc says, I don't want to do that because I could be making $1,000 an hour, but I'm actually making 130. What is that return on investment? Where is your time spent best? I think that's probably the most complicated question for somebody to answer, somebody who doesn't have the handle on their numbers.
I don't want the conversation to be all about the money, right? And you've led large wellness organizations, in a huge health system, one of the largest in the US. What does a healthy practice feel like from the inside when you were there and had all the resources that you had? What does that healthy system feel like, and how can you treat the patients that come in when you have that support?
It was still all about the money. It's like if you can't make money in a health system, a lot of doctors are working on it. They have to get more patients and they have to see more, and the health system tells them what to do. In my case, it was pretty good because I was offering large group programs for using alternative therapies, holistic health practices for large groups of people, hundreds of it at a time. So it was really, in a sense, very profitable because we could sell the programs at a lower price point per person. I think a lot of doctors in private practice ought to be looking at a small group model where they can bring a few patients in if they have the kind of therapies that are amenable to that. So I was joking when I said it was all about the money in a sense, because as a practitioner, we need to generate the balance between the getting the money that we need and serving the patient. And so if we're dominated by getting the money, because a lot of people feel they have to be or they're forced into it, the patients are going to suffer big time. So, I think, and in medical school, there's no training that I know about that teaches doctors, really effective patient communication, taking how to nurture a patient along. They're not taught listening skills because there's no time to listen anyway. It's just crazy. The whole kind of goofy like that. I don't know. I think it comes down to, we need to change practitioner training is what I say. But what Tatiana is doing is really helping patients in general, because when you're working with a practice, Tatiana, you're helping that person relieve some of the financial stress, which is automatic for them And that's what messes up the ability of the practitioner to treat the patient in a way that the patient deserves and wants to be treated. Hats off to you for doing that. And the people who engage with you are benefiting enormously, because we got to reduce the financial burden. There's a huge financial stress that goes with having a private practice. Some doctors like to, and practitioners like to work in a big healthcare system, but that big healthcare system still runs their medical or their treatment life. How many patients you get to see, how much you make. It's just, and I heard all the complaining when I was there, so I know all about that. And anyway, so that's my thoughts on
Right.
that.
And even in the systems, it really is it is about the money still. I still recall a guy I met up, run a nonprofit healthcare organization, did many things, home care, other stuff, part of it in the Bronx. And he says, no, I wasn't surprised, but he said, I bet you're surprised how much I understand my numbers. And I said, I didn't say anything. So I just knew he was proud of himself. He said, I understand my numbers because even though I'm nonprofit, if I'm not profitable, I can't have the reach that I want to have. I can't serve the number of people that I want to serve.
Yeah, a nonprofit organization cannot exist without being profitable to whatever the ceiling is allowed.
Yep.
If they don't have profit in there, they're done. So I hear you, Tim. Really.
All right. So now, Tatiana, you've kind of held up Nirvana a little bit, Shangri-La, whatever you want to call it. And we want to know, have you got an example? But for practitioners or others listening out there, is there really the hope, and have you seen one where the practitioner is happy, the staff is happy, and there's no turnover, and the patients are being served well, and they're profitable? Does that ideal really ever exist?
It exists more than you would think. But here's the thing. It starts with the provider. It starts with the leader. In accounting, we have this expression after the financial bubble in 2000, 2001 with WorldCom and Enron, tone at the top, right? Back in the day, the CEO and the CFO of Enron claimed that they didn't know that this accounting fraud was going on, right? And they went to prison because the government was like, no, tone at the top. There's no way you didn't know, right? And so I think it starts with the doc and really come to Jesus moments, really with themselves. Look in the mirror. Who do you see? Do you see a healthy person, human being, that sleeps 8 hours a night, that exercises, that eats clean? Because all of those things are what makes our brains work well. Like, I give this example often, and you probably heard me say this, but like when I sit down, I start working at 7:30 in the morning because I have some obligations and things like that. I have to drive my daughter to school and whatever. But I wake up at 5, I exercise, I take my supplements, I take my thyroid medication and whatever. And then I sit down, and sometimes I have calls with a couple of partners in the healthcare space. And they're like, what are you smoking? And I'm like, nothing. I just feel really good. I feel really good. My brain flies. And I've seen providers that have over time have gotten to that. And it's a huge change. It takes an enormous effort, and nobody really takes it for granted after all of the work that needs to go into that. But it starts with, if you ever read that book called Atomic Habits, it starts with building routines. And I have one client who's on his way to that point where he's practicing what he preaches in his own life. And when, he comes into the practice, the staff is happy because he also supports and treats staff, sees staff as patients free of charge as a benefit of the practice. He helps them be healthy because when they're healthy, their brain works well. They take care of the patients too.
Yeah.
It's excellent. Now, the practice that is just surviving versus the practice that is thriving, there's not a real big gap between their clinical skills, right? It comes down to the systems that you have in place for them, the visibility and the willingness for them to check their numbers to see what's actually working and what's not. So let's get a little more into that on practices, difference between surviving and thriving. So what are some early warning signs, though, Tatiana, in a practice that is developing a problem before those problems become chronic, right, or a real crisis? What should that provider be watching for?
Now, I say this with the disclaimer that the goal of this is not to make you an accountant. The goal of that is not to make you an analyst. The goal for a provider is to know every number on their P&L. Ideally, balance sheet too, but a lot more people who are not accountants struggle with the concept of balance sheet than the P&L. P&L is easier to understand. I come across this often. Your P&L shows that you're making $500,000 for the year. What do you mean? Where's the money going? I don't have that money. And then you look in the balance sheet and you're like, well, you're paying down debt. You're also spending off the charts for your personal stuff. That's where it's going. So it's usually a painful exercise. So typically when, let's say, we do a service called a financial modeling, we develop a financial forecast, a budget, if you will. We start going line by line. Okay, what are you making here? What are the expenses associated with that? What is it for the following year? What is this for the next 12 months? Because what it does is
that you were really going into, and I want you to kind of break that down a little bit more. But first, I got to ask you, as you go to work with a provider, do you take insurance?
no,
No way. No way.
but we get you at least a 3x ROI every year on our fees, at least.
So getting to that 3x
Guarantee that. You
return,
guarantee that.
when a provider starts assessing these problems and that you've seen, looked inside, what's the real process that they have for working with you? How do they engage you? What do you start with when they say, hey, here's some problems I'm seeing on the inside that I just can't figure out? They've spotted those early warning signs you're talking about there.
I think their biggest hurdle to that conversation is because often not doing well financially, they use that as a self-attack. I'm a failure. So that's the biggest hurdle for me when I talk to providers, right? No, I'm okay. I don't need help. But then when I start working with them, when my firm engages with them, the first really thing is same as a doctor would do, diagnose the issue. And I provide it as a diagnosis or a second opinion.
So that
So we
first
second opinion anything.
that first conversation you have with them on let's just even step back a second before. How do they first really come to you for? Do they just realize it? Did they had to a buddy, a colleague say, look, I think you really ought to talk to Tatiana. How are they reaching out to you?
Usually it's referrals from other providers. And the referrals usually sound like this. She did more for us in 2 months than 5 different accountants did for us in 13 years. She transformed our business. Had I known what this financial modeling is, I would have engaged her 6 months ago on that. That's typically what it sounds like. Somebody says, I want to start over, I want to restructure, and I can't do it without you. Can you help? And if I say yes, they're like, okay, let's do it. Otherwise, I'm not going to do it. That's what they say.
Okay. And so then what's that first that first diagnostic conversation look like with you? What happens?
I call it a second opinion, and I call it a second opinion because I want to see what are the gaps. I want to identify gaps. Is it lack of accounting? Is it not optimized tax? Is it staffing? Is it culture? Is it business model? Is it revenue model? What is it? And sometimes there's obviously more than one gap. And so we start with that. And then I prioritize it and I say, okay, these 2 need to be addressed first. And then we can get to the tax savings or whatever. Sometimes if I do some sort of a trade show or whatever, people come in on the tax second opinion. So we just, no obligation, standalone service. We'll look at all of your data and I tell you, okay, where are the missed opportunities, audit red flags, sometimes fraud, mistakes, and all of that. And I just show it to you. And then the provider is like, oh my God, like what is happening?
I just want to say it's eye-opening. And I'm just going to throw this out there right now because it's just in my mind so strongly. A practitioner who notices that they're stressed in their practice and they think money has anything to do with it, pay the money at the consult, whatever it takes, because they got to take the step. Otherwise, they're going to continue to do the same thing over and over again and suffer. And on the patient side, like if we have in our listeners out there, when you go into a practice, you're interviewing the whole practice and especially the energy of the practice. Like, how do you feel when you walk in the door? How do you feel when you talk to the people behind the desk? When do you feel like the practitioner is engaged? And if you don't feel really good about it, get out of there. Just don't go because it's not worth it to you. You're not going to get the service you need. It's going to mess with your energy and health. And so those are my 2 things I wanted to put in there. The providers need to pay the money and get the consult, or if it's a free consult, take it, go for it, get the analysis done because that's the first step. And work on yourself. As you said, they got to work on themselves too. And then for the people who are listening who are patients, really just it's treated like you're interviewing the practice, whether you want to stay with them or not.
Good. So for a provider that does want to take a deeper dive with you, Tatiana, How do they find you?
Like live on Instagram. That's probably the quickest way to find me, or you can just Google my name, Tatiana Tsoir, my websites, my book, my TED Talks will come up. That's the best way to reach out, the easiest way to reach out to me. And then we can have a conversation. No obligation, no strings attached. You can just look and see. Look and see what,
Yep. And,
what you've
and,
got.
and for those listening, Sawyer is spelled in this case Tsoir with Tatiana up there. She's been trying to teach
Well, I
me
have,
the real European pronunciation of it, but my tongue just won't work. So we're going to stick with Sawyer, Tsoir.
so I just want to put in one more thing, and that is that, every Olympic athlete, I'm not sure there's ever been one Olympic athlete that didn't have a coach. And so, Tatiana, you're like an Olympic coach producing great results, and you don't have to be a practitioner. You don't have to be somebody who treats somebody in the health arena. You just have to know how to coach the practices and the doctors and the other people who are in the practice. You just have to know how to coach them. And that's the beautiful thing about, that's why I'm saying for the practice doctors and anybody else in the practice, get the consult, pay the money, get the consult, and learn what there is to learn, and get the excellent coaching from somebody like you, Tatiana.
Yeah,
Good.
excellent.
Now, one thing back earlier, you said, I think you and I had talked about this a little bit, Tatiana, where you talked about the fraud. You mentioned fraud, and you said sometimes you uncover that. How common is it that you see fraud or theft going in underneath a doctor's nose?
Sometimes it's almost like a negligent abuse, not outright fraud, not outright theft. Theft is fairly, I would say, uncommon, but happens. But I think that spending $4,000 on paper is theft, even though the office staff is not stealing directly from the doctor, but it's
Where do they put all that extra paper that they have accumulated?
right.
Stacking it up in a closet or what?
Like, are they selling it on black market?
Yeah,
Like,
yeah,
what
really.
is
Yeah,
that?
yeah, yeah. Dealing in paper.
In terms of what I see most is things like that and audit red flags, unnecessary audit red flags. 99% of the cases I go through. So, to have a second opinion on tax, you just need to submit business personal tax returns and some other information. And then I take some time, I take a look at it. So I come to the call prepared to discuss your specific situation. And I usually start with, here's what I found on your taxes. Sometimes the business doesn't jive with the personal. So one number that's supposed to go from business to personal is different. Things like that, and audit red flags and other things that will trigger an audit. And so I typically just tell people, just don't file it. Just file an extension or whatever. Let's take a look at it. Let me review it before you file to save money, and stay with the prior practitioner for just another month. But that happens in 99% of the cases. I maybe through my whole career saw maybe one or two sets of books that were up to my standards. Taxes that were done without an issue, detailed, split, beautiful, maybe one or two times.
All right. So, and I think Bob touched on this a little bit when he was advocating, just reach out to, but I want to give you a chance to articulate it yourself a little bit. So if you could say one thing to every healthcare provider listening today, the provider that got into that medicine to change lives and is now wondering why it feels so hard to sustain now. Why am I struggling? What would you say to that individual?
The reason is the person in the mirror. There are things that need to be done, decisions to be made, and it starts with you. It starts with you in accounting. It starts with you in health. You have to make a decision that this can be done better, no matter how uncomfortable it may be. And you just have to find a way to start changing that.
Excellent. Well, Tatiana, we sure appreciate
Get a
you.
coach.
Yeah, being on the program today. It's great to have you on and touching on something that doesn't get enough attention in healthcare today. So, the great clinical care and a sustainable practice are not competing priorities. They depend on each other. We looked at specific ways practices leak profitability without knowing it. We explored what becomes possible when a business behind the care is healthy for the provider and for their team, and then also the patients that they serve. And we talked about what it actually takes to build towards this deliberately, right? To have a healthy practice. The aha for me today in today's episode is every business decision inside a practice has a patient on the other end of it. So keep that in mind when you're making those decisions. A practice that cannot sustain itself cannot fully serve anyone, but a practice that is financially stable and is operating strongly, it's not just profitable, it's more capable of doing what brought a provider to medicine in the first place. So today's conversation felt like, if this is something that resonates with you as a practitioner, we invite you to email tim@wellnesswaveclub.com if you want to join a how-to webinar that is going to be provided for providers. Subscribe to the Wellness Wave Club YouTube channel, join the Wellness Circle community on Facebook, and share this episode with a provider who needs to hear it. And always remember, wellness, it's in you. All right, thanks everybody that joined